Hello, welcome to the MBQuip Abstraction Training video sessions. In this session, I'll be discussing how to abstract the outpatient ED throughput measures. We'll go over how to determine the population and discuss some of the data element questions you need to answer for the measures. This is the ED throughput section of the CMS Hospital Outpatient Quality Reporting Manual. In this session, I'll be using the version of the manual for use starting with Q1 2020 encounters. If you don't know how to locate this section, video 2 of the abstraction training sessions discusses how to find the specifications manual on the CMS QualityNet website. The ED throughput measures are made up of two measures. The ED throughput measure set are made up of two measures. OP-18, which is median time from ED arrival to ED departure for discharged ED patients, and OP-22, left without being seen. Now, data entry for OP-22 is a little bit different. It's not a chart abstracted measure, such as OP-18, so we'll come back and talk about that one after we finished OP-18. In this section, it describes the measure in detail, but because this session is we're just talking about abstraction, that's just what we're going to focus on. So your first step in abstraction is how to determine your population for the measure. And what we mean by population in abstraction is these are the records. Which records do I need to abstract? So your population are the records that you need to abstract. So we're going to scroll down here and we're going to get to the population. So your population for OP-18, it's patients seen in the hospital emergency department and have an E&M code on Appendix A, OP Table 1.0. Okay, that's the only requirement. Now let me say it doesn't state this here, but we are talking about patients who are seen in your ED and then discharged or transferred elsewhere. They don't include patients seen in your ED and then directly admitted. All right? So these are patients seen in your ED and then discharged or transferred elsewhere. So they just have to have an E&M code. And where you find that is in the specifications manual, in Appendix A, the E&M codes. So every patient seen in the ED has an E&M code. If it's one of these codes, then they would be eligible for the population. That's it. There's no, doesn't matter what their, where they were transferred to, where they were discharged to, again, except they're not if they're direct admits to your facility. Even though perhaps you have to discharge them, quote unquote, for billing purposes or whatever, if they're in your ED and go directly to your facility, they are not counted. These are patients who get discharged or transferred elsewhere. But there's no ICD-10 code requirements or anything. It's just having an E&M code. So that's your population. These are the records that you abstract and submit to the QualityNet warehouse. How you answer the data element questions, and that we're going to go further and show how that, what those questions are. So how you determine those questions, that determines how you answer those questions, that determines whether the case passes, fails, or is excluded from the measure set. You don't remove cases from the population. If they meet this requirement of having an E&M code, then they should be abstracted. Now, because this requirement is just having an E&M code, you might have a high number of cases. So if a hospital's number of cases in a measure set meets certain size requirements, you can choose to sample rather than do all of the cases. And like I said, because the population requirement for the ED throughput measure is just having an E&M code, which is probably most everyone who's seen it in your ED, you could have a large enough number to be able to sample. So how that's determined is you're going to go to the population and sampling section of the outpatient specifications manual. Right? And this section, it talks about, what a population is. I'll let you read all of that. I'll get you to where you want to go to determine the size for, okay, because there are different tables for different outpatient measures. But for OP-18, which is what we're doing here, this is the table. Okay. Now OP-22, excuse me, OP-22 has a different, like I said, it isn't the same kind of measure. It's got a different population. So we'll talk about that back when we talk about OP-22. But this is the table for the sample size for OP-18. So if your hospital sees between 0 and 900 patients for a quarter that meet that ED population, you would need to do 63 for the quarter or 21 a month. If you see 901 or greater, then you would do 96 for a quarter or 32 a month. Now, you don't have to sample. You can do all of the cases if you want. You can do more than what is listed here. This is the minimum. So you have to do at least this or anything greater than that if you want. Now, in this section about sampling, it doesn't really tell you how to sample. It talks about a random sample. And so it doesn't give you specific instructions about how to do random. But, I wouldn't just pick a day and do everybody in that day or, in that week. What you want is, you want to get different staff that's working in the ED, different shifts in the ED, because you want to make sure that everybody who's working in that ED is doing things the same way. So, again, you decide on the random. CMS doesn't give you instructions for that, but just saying that you should do a random sample. Okay, so once you've determined your population, you're ready to abstract. And so what does that mean? Okay, well, in abstraction, there are questions that you need to answer on each case in the population. And then how those questions are answered, how those data elements are answered, that determines how your hospital is performing in the measure. So to show you what the data elements are, the easiest way to do that is I'm going to pull up this cart paper tool. And if you're not sure how I found this would be in session 3 of these training sessions, how to find the paper tool. But you don't have to be using this paper tool or even using CART. You can be using a vendor tool, or maybe you have data directly pulled from your EHR that goes to QualityNet. It doesn't matter. The abstracting questions and the data elements for the measure are the same, no matter which method is used to answer the questions or determine what the data elements are. But this is just an easy way for me to be able to show you here what are the data elements for OP-18. So here, what was the earliest documented time the patient arrived in the ED? Well, it seems pretty clear, but what if you're not sure? Okay, where you're going to go is to the specifications manual. This is the specs manual, the alphabetical data element list. So these are a listing of all of the data elements for abstraction, and then the ones that apply to the different measures. So I'm going to point out a couple that I think some people have some issues with. And let's just take this arrival time. So what was the earliest documented time the patient arrived in the ED? Okay, and it seems easy enough, but there are some instructions. That's what notes for abstraction are. Okay. Tells you what you should reference, tells you what you shouldn't reference. I'm not going to read them all for you. You need to read them though. If you're just starting abstraction, you need to know how to determine what's the correct answer, what's the correct way to answer that question. Gives you only acceptable sources. So to answer this question, you should be looking at your emergency department record. Any of these forms that make up the emergency department record, but that's it. Okay, you can use observation record if the patient would be coming from there. But that's what you're supposed to look at. Okay, tells you not to look at these if you have these still in your record. Okay, so that's how you read these instructions. Now, if we go back and look at another one, name, sex, race. People don't usually have difficulty with those, but here's another one. Okay, what was the patient's discharge code? Okay, now it seems easy enough, but look at some of your choices here. You've got different ones for, 4 different ones depending upon the acute care facility. And you've got other healthcare facility. Well, what is that? Okay, so we want to go back here to the alphabetical data dictionary and look at discharge code. So what was the patient's discharge code from the outpatient setting? You've got allowable values, but what fits in there? You've got some notes. Read through your notes. Okay, these are your suggested data sources. Okay, don't use your billing. Okay, because oftentimes maybe what the hospital used for billing, their discharge codes might not match what the abstraction discharge codes are. So, sorry for scrolling, but back if we look up here, value 1 was home. Okay, so down here it's telling us what fits into home. Assisted livings would be considered home. Jail would be considered home. If the patient had home with home health services, that would be any discharge to any of those facilities would be value 1 home. Okay. Now, the one where there's a lot of difficulty is value 5. Now, value 5 was other healthcare facility. So what for abstraction fits into other healthcare facility? Okay, this is what fits in. Extended or intermediate care facilities, long-term acute care facilities, nursing homes, rehab facilities, skilled nursing facilities, swing beds. If you have a patient who was transferred or discharged to anything that fits here under value 5, then that gets listed. The discharge status is other healthcare facility. Now, the big issue here where people have problem is patients who go to the nursing home, because a lot of times hospitals will consider it to be, if the patient resides in the nursing home, if that's where they live, then they're seen in the ED and they go back to the nursing home, then it's considered home. That is not correct for abstraction. These patients are being transferred or discharged to, doesn't matter which term you use. If it's transfer, if it's discharge, doesn't matter. They are going to a nursing home. That's value 5. So it is not correct to put a discharge status of home. It is other healthcare facility. All right. I mean, one where it looks easy enough, but it isn't correct if you're putting home. So this might be a situation where someone's run a program for you and they're pulling statuses. If they're pulling home, if your nursing home patients aren't being included, maybe that isn't correct. So again, you've got to make sure that it's fitting into the abstraction correct discharge status code. Not a lot of questions that you have to answer for these ED patients. Okay. Back at the beginning, you're looking for arrival date and time, and then we're down to the end. We're looking for departure date and time. Okay. So let's look for departure back in the dictionary. ED departure time. Okay, what was the time the patient departed from the ED? But you've got notes for abstraction again. You've got instructions. Because what if there's more than one time? Which do I take? You want the time the patient physically left the emergency department. Okay, don't use the time the discharge order was written, because that might not be the time the patient actually left. The physician could have written the order, but maybe for whatever reason, the patient is there for an hour, a couple of hours. You want the time the patient physically left the department. So, tells you what to do if your patients go to observation. Tells you phrases that are included for time. Tells you what they don't want you to take. Okay? So it isn't as easy as just saying, oh, it's, this is the time. These are the instructions, so you pick out the right time. Something else I want to show you, if we're back in this section, again, this is for OP-18, the section. If you're doing the measure, and I apologize for scrolling again, but I want to show you. Okay, when you get to OP-18, you might see it referenced, like on reports, there's 18A and B and C and D. Okay, when you're abstracting, that's irrelevant. You don't worry about A, B, C, and D. You abstract like those measures that I showed you with those data elements. What happens here is oftentimes patients who are seen in the ED, depending upon what kind of why they're there, maybe they're there longer. Okay, so patients who have a mental health diagnosis, maybe they're in the ED for a little bit longer because it isn't so easy to figure out maybe where they're going to go. There might be more planning involved in that. So what this does, what CMS did, is they break out, depending upon what the ICD code is that's entered, they'll take those patients out of the reporting measure, which is OP-18B. So that's what you'll see on your MBCRIP reports, because they don't want to give you an inflated time of ED arrival to ED departure for patients who are maybe, again, usually are there longer because of the uncertainty about where they might go. So, but none of that matters when you're abstracting, okay? How you're answering data element questions is what puts that patient into the right one of these. So overall rate is for all of the patients, doesn't matter. And then reporting rate would exclude the ones where there might be some more, they might be in the ED for a little bit longer. Okay, let's go to OP-22. So OP-22 is left without being seen. So these are patients who leave the emergency department without being evaluated by a physician, an advanced practice nurse, or a physician's assistant. So this data gets submitted once a year for data from the previous year. So for example, in 2020, you'll be submitting data for 2019. And it's data for the full year. If for some reason you haven't been collecting this for the full year, then don't submit data, because your data isn't going to be accurate. It's going to be looked at based on the thought that it was a whole year's worth. So you don't want to enter this until you've got a whole year's worth of data. Okay, so again, you're going to be asked two questions. What was the total number of patients who left without being evaluated by the physician, APN, or PA, and then the total number of patients who presented to the ED. Now, CMS doesn't tell you how you should be collecting this information. Believe the thought process is that this is something that most facilities do keep track of. But it does give you information about, the definition, patients who presented to the ED. So those are patients who presented and are signed in to be evaluated for services. Tells you what the definition for the physician, APN, or PA. So who we're talking about there. Okay. Now where this data gets entered is in the secure portal of QualityNet through that site. And back in the session that talks about moving around in QualityNet will show you how to get to the secure portal. But it's submitted through the secure portal. You log in. You're going to choose Hospital Quality Reporting. And then, you're going to put in your password. And you're going to look for outpatient web-based measures. This is what these are considered, outpatient web-based measure. So that would be like on the My Tasks page after you log in. And then first thing it's going to do is ask you to pick the payment year. So the payment year is really 2 years after the year of data that you're collecting. So for example, now if you're doing this, if in 2020, if you're entering this data in 2020, the data you would have collected was for 2019. Okay, 2019 data gets collected, gets entered in 2020, but your payment year, that's what it will ask you for. Your payment year would be 2021. Okay. I think it would be less confusing if I could show you the site, but I don't have access to be able to log in to that screen. But once you get into the secure site and go to the web-based measures, you'll be able to find out how to enter. One thing I can say, a lot of people will ask, this doesn't include AMA patients. Okay, those are patients who left against medical advice. And if you're leaving against medical advice, then you probably were evaluated by the physician's assistant, or APN. So that wouldn't fit because they would have been seen. So it isn't AMI patients. Okay, to kind of recap, first thing you're going to do is determine your population. And then you want to follow the instructions correctly to follow the instructions correctly from this alphabetical data list to answer the element questions. And I want to just say, if your data is being pulled directly from your EHR, okay, if maybe you aren't going into the record and pulling out this data, it's still your responsibility to make sure that the data is being filled, the data is being pulled from the correct source, okay, from the correct data field. The instructions on how to answer the data element questions must be followed for your information to be accurate. So whether you're going in and answering these questions, yourself in CART or a vendor tool, or if this information is being pulled from you, you need to make sure that whoever is maybe developed that report that's pulling that data from your EHR, that they've pulled from the correct field that's really answering these questions correctly. Because even though you have a question such as, which like I said at the beginning, it looks pretty clear. What time did the patient arrive? Or what was the discharge time? Sometimes in an EHR, that question, that value is there more than once. I mean, you might have a couple different spots in the record where it says the patient arrived, or a couple different spots where it says that they were discharged, because of different people putting things in the record at different times, or in different spots. So you have to make sure that, the patient just arrives once. They just are discharged. The earliest time, the time they left is once. So you've got to figure out, when you've got in your record more than one spot that says those words, which is the correct one. That's why you need to look at those instructions and see, okay, what are we looking for? The time the patient physically left the ED. So if you have 3 discharged from the ED times, which is the one that really means when they left? And so if you've got someone who's pulling this from your EHR and putting it in a report, they have to know those instructions as well to see this is the correct time. This is the one we should be choosing from these 3 different values. Okay, and just like to pull up this slide to show you that if you have any questions about the MBQuip program, you can contact your state flex coordinator. And if you aren't sure who that is, here's where you can find a listing of the flex coordinators. And if you have any abstraction questions, you can always contact me. Thank you.